Do you find it challenging to build trust and rapport with your patients? Are you struggling to explain complex medical information or handle difficult conversations effectively? I'm going to share essential communication tips that will help you connect with your patients, simplify medical explanations, and navigate those tough discussions. I'm Dr. Ariana Demers, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. One of the important aspects of patient care is communicating effectively. As I see it, it is my job to decode the medicalese and help them understand in plain language with straightforward examples. Here are some communication tips for talking to patients. First, let's talk about building trust and rapport with patients. Trust is so important because it forms the basis of that patient-doctor relationship. One of the best ways to build trust is through active listening. This means giving your full attention to your patient, nodding, listening, actually listening, and responding appropriately. My AI scribe has helped a lot with this because I don't have to be clicking and typing. It's recording the whole thing. And then you can show empathy, acknowledging their feelings, and really actually being concerned. And this goes a long way. Additionally, consistent follow-ups and check-ins show patients that you care about their progress. Next, let's move to explaining those complex medical things. This can be challenging because medical jargon and medicalese can be confusing. And one effective strategy is to use analogy that relate to everyday experiences. So, example, when I'm talking about nerve compression, I tell them it's like parking your car on a telephone wire and the information doesn't get there. You can use visual aids or charts or models. Always check for understanding by asking patients to repeat back what they've understood. I always ask, what is your understanding of what I've said in your own words? So remember, explaining complicated procedures using simple diagrams has really made all the difference. So when we're talking about handling difficult conversations, whether it's delivering bad news or discussing a poor prognosis or a poor outcome, these are never easy. But the key is to remain calm and super compassionate. And be honest. If there's any hope, great. But ultimately, being straightforward and not beating around the bush while still being empathetic is really important for maintaining patient grace and dignity. If you've found these tips on effective patient communication helpful, please stay tuned for our next video where we talk about how healthcare marketing uniquely differs from other industries. You won't want to miss this. Please drop your comments or thoughts and give this video a thumbs up and share if you're liking this. And don't forget to subscribe to my newsletter. Just click the link below.